Are you getting pain in the front of the knee when going downstairs, squatting, or kneeling on the knees? Sometimes you feel that familiar pain just sitting in a chair. What the heck is it, and how do you get rid of it so you can get back to the activities that you love?
Hi, I'm Liz, physiotherapist from My Physio to Go. In this video, I'll go over which structures may be causing your front of the knee pain, how it can cause the pain, then go through a simple strengthening and stretching routine to help get rid of it. Before we start, I want to give a big thank you for all of you tuning in. Your comments, likes, and subscribes mean a lot to us and keeps us excited to make more videos that are meaningful to you. If you have any topics you would like us to cover, please leave a comment down below and we will do our very best to get that out to you. Without further ado, let's get started. A common cause for front of the knee pain is patellofemoral pain syndrome, or PFPS. PFPS affects more females than males, and it is caused by rubbing and friction of the kneecap on the femur as it glides over the joint during bending and straightening of the knee. Extra friction can be caused by more compression or protracting of the kneecap over the joint. If we take a look at the structures around the knee joint that can potentially be the cause of the extra stress, there are the quadriceps muscles, the medial and lateral side, the IT band, the calf muscle, and the hamstring muscle. As well, we can't forget about the hip joint because the hip controls and allows the knee to move side to side. The gluteal muscles are important in the controlling of the hip joint in this side-to-side plane of motion. Let's take a closer look. Weak quadriceps. The medial quadriceps, also known as the VMO, is attached to the inside of the kneecap. The lateral quadriceps, called the vastus lateralis, attaches to the outer edge of the kneecap. Often, if there's an imbalance of the two muscle groups, the VMO is the weaker one, allowing the vastus lateralis to pull the kneecap outward. This causes poor tracking and friction on the kneecap as the knee bends and extends. Weak gluteals. Research has shown that those with PFPS have delayed contraction of the gluteus medius muscle as well as a weaker contraction. More specifically, the gluteus medius decreases hip control, leading to poor knee control, causing your knees to fall inward as you walk or run. This results in more stress at the patellofemoral joint, causing pain at the front of the knee. If you ever see someone run with a classic lateral whip, this is usually caused by a weak gluteal muscle. The IT band is a thick connective tissue structure that runs from the hip all the way down to the outside of the knee. If this band is tight, it can turn the lower leg outward, resulting in abnormal tracking of the kneecap over the knee joint, causing friction and pain in the knee. The calf muscle originates above the knee joint and attaches down to the back of the foot through the Achilles tendon. The calf muscle helps bend the knee as well as it allows you to go onto your tiptoes. If you have a tight calf muscle, the knee is resting in a more flexed position, causing more compression forces at the patellofemoral joint, leading to more pain and friction. The hamstring muscle attaches to the back of the knee joint on the lower leg. If the hamstring muscles are tight, it puts the knee joint in a flexed position, putting more compression forces through the patellofemoral joint, similar to a tight calf muscle. Follow this exercise program to help regain normal patellofemoral function and get rid of the pain.
I find this exercise very helpful for most of my patients with PFPS. Grab a band and put it around the thigh. The band has to be tight enough so it feels as if it's causing the knees to come together. Now stand with the legs hip-width apart and squat down to about 90 degrees while pushing the band outward, maintaining the knees at hip-width apart. Repeat 15 times, 2 to 3 sets. This is a great exercise to help activate the VMO during quadriceps strengthening, as well as training control of the gluteal muscles. Put a band around your ankles. Tighten the core and have a slight bend to the knee. Bring one leg out to the side, then bring the other one to meet it. This muscle specifically targets the gluteus medius and minimus muscles, the most important ones for hip stabilization. Repeat 15 times, 2 to 3 sets on each side. This is a really good exercise for hip and knee control, as well as strengthening in a functional position. With running or going downstairs, we commonly need to have control of one single leg. Stand on one foot, bend the knee going down for a quarter squat. Make sure the knee tracks over the second and third toe and not beyond. Repeat 15 times, 2 to 3 sets. Stand beside a wall or a chair. Bend one knee, grab the ankle, and bring it to the bum. If you can't reach your ankle or foot, use a towel to wrap around the foot and pull the towel up toward the bum. Hold 30 seconds, repeat 2 to 3 times. Lay on your back, bend one knee and bring it across the body towards the opposite shoulder. You should feel this stretch along the outside of the bum. If you don't feel enough of a stretch, you can do the pigeon pose in yoga. Start in the seated position and bend the front knee in front of you. Bring the other leg behind you, keeping it as straight as possible. If you can, lean forward to further the stretch. Hold 30 seconds, repeat 2 to 3 times. Stand in front of a table or chair. Bring the leg you want to stretch behind and out to the side. Bend the front leg to lean into the stretch. You should feel the stretch at the outside of the hip and a bit down the side of the leg. If you can't get a stretch in this position, lay on your side with the knees bent. Bring the foot of the bottom leg and place it on top of the outer thigh of the upper leg. Let the upper leg fall down towards the ground. Hold 30 seconds, repeat 2 to 3 times. Sit upright against the wall with one leg straightened out, one knee bent. Bend forward at the hip and bring the belly in towards the upper thigh. Feel a stretch at the back of the thighs. Hold 30 seconds, repeat 2 to 3 times. Stand in front of a wall or chair. Bring one leg behind, keeping the knee straight. Bend the front knee and feel a stretch at the lower leg muscles on the back. Make sure to keep the heel down on the ground. Hold 30 seconds, repeat 2 to 3 times.
I hope you learned something from this video. Try doing these exercises consistently 3 to 5 times a week for 4 weeks. Please leave a comment down below and tell me how you like this program. See you next time.